that encompasses a continuum of behaviors from severe use to total abstinence, meaning not using at all, and acknowledges that some ways of using drugs are clearly safer than others.
Right, and the principles of harm reduction also establishes quality of life for these individuals and community life and well-being. Not necessarily the cessation of all drug use as a criteria for successful interventions and policies. For one, everyone's different. What works for me may not work for the next person.
Harm reduction calls for the non-judgmental, non-coercive provision of services and resources to people who use drugs and the communities in which they live in order to assist them in reducing attendant harm.
So the principles of harm reduction ensures that people who use drugs and those with a history of drug use routinely have a real voice in the creation of any of the programs or policies that are designed for them. Again, it goes overflow with any, whether it be addiction, living with HIV, we're the best resource. We're the ones that are living that, we're the best resource.
Harm reduction affirms people who use drugs themselves. As the primary agents of reducing the harms of their drug use and seeks to empower people who use drugs to share information and support each other in strategies which meet their actual conditions of use.
It also recognizes that the realities of poverty, class, racism, social isolation, past trauma, sex-based discrimination, and other social inequalities affect both people's vulnerability and the capacity to effectively deal with any drug-related harm. And that's the whole purpose of having someplace and a safe place for them to go. That's where harm reduction comes into play.
Lastly, it does not attempt to minimize or ignore the real and tragic harm and dangers that can be associated with illicit drug use. So really, all of this is kind of, as we were saying, putting people who use drugs in control of their own decision-making around their drug use and supporting each other in making decisions that can allow them to use more safely.
And as a person who's living with HIV and as a former active user, I quote unquote, I guess if you go in the terms of what the federal government says, I'm still a user because I'm smoking marijuana for my medical needs. I'm still reducing my harm. I'm not doing the other drug, the hard pain pills. I'm using marijuana to reduce that harm. So that's part of harm reduction also. Just because it's still using doesn't mean that you're not reducing the harm. And those of us living with HIV, we have pains. Sometimes I've had some messes with our stomach, and that really helps us. So again, that's part of harm reduction. Some other harm reduction examples are our syringe service programs, carrying Narcan and naloxone. I have Narcan in all kinds of places because you never know when you're going to run into somebody. And again, using less harmful substances and using condoms during sex.
Is everyone familiar with what Narcan is?
Is there a syringe exchange program where you live in Baton Rouge?
I run ours, Rich Javara is our executive director, I'm the coordinator, so we have our Be Safe syringe program in Baton Rouge.
And in New Orleans, there are 4, I believe, and Women with a Vision operates one of those.
Okay.
Yes, and we'll show you where they all are in the state.
I'm sorry, is it okay to ask?
Yes, we actually do.
But as I recall, and it's been a while since I've been up on this information, but are there still some legalities around, like even what you call it, like you can't technically call it syringe exchange or something, or has that changed?
Yes, so in Louisiana, there's not a blanket statewide law that allows for syringe services programs. Some people don't call them exchange because they're not all literally like one for one. Some programs you have to bring some in to get new supplies. So right now there are 4 cities that where it's legal. Maybe 5.
We have a map.
Yes, and so if you're outside of those areas and you are caught with paraphernalia, you still can be, criminalized under
You
that.
mean 4 cities within Louisiana?
Yes.
Oh, okay.
In some states, they have, statewide laws about it, but that's how different.
I'm sorry, one more question.
Yeah.
And do you have safe houses?
Like safe use spaces?
No, we do not,
Okay.
unfortunately. We don't even have low barrier shelters. So if a person is on methadone or Suboxone and they want, because they're trying to change their life, they're not allowed in our shelters.
Oh.
Yeah,
Yeah.
it's really, which is why we have such a high population of unsheltered in Baton Rouge. A lot of our guests are the same on the unsheltered side and as our guests in the office.
Do you wanna ask that?
Yeah, does anybody else might know, having harm reduction, how might it apply to your life?
I'm sorry.
How harm reduction might apply to your life in different ways?
Or anyone's life, it's not necessarily yours, but outside of like drug use, I guess.
Yeah. I mean, I could say that, I don't have multiple partners because I'm in a monogamous relationship. That is harm reduction. And I'm thinking harm reduction that prevents me showing up at the HIV clinic.
Correct.
That's what I'm thinking.
Yeah.
So that's one way, I use harm reduction. I'm also trying to reduce my harm I'm getting from my husband smoking cigarettes.
That's you reducing your harm, 100%.
I don't know how, I need help with that. You know what I'm saying? Yeah.
That is.
Cause it's because addiction is progressive. And I'm watching him saying he's gonna stop, and I'm watching him progress, and, yeah.
That is a good example though, because like using nicotine patches or gum or something, that could be a form of harm reduction.
Yeah, that would be harm reduction for him.
Yeah.
But once it is for me, yeah.
So I'll let
Okay.
you do the
Well,
job.
some other ways that we wanted to just bring into this, because, looking at it as a larger framework, there's a lot of ways that this can apply outside of drug use. One is being educated about like the laws in your area so that you know what your rights are, and sharing that information with your community so that they can be safe as well.
The criminalization of drug use, paraphernalia, knowing the Good Samaritan laws, that if you can be charged if you take somebody to the hospital, if they're overdosing, if you call 911, those are things that you really want to know, and that's going to be reducing harm in your community and possibly for yourself.
Yeah, so in Louisiana, we do have that law, so it encourages people to call for help if someone is having an overdose so that they shouldn't be criminalized. I'm not gonna say it never happens because Louisiana likes to charge people with things when they can, but you are supposed to have sort of an amnesty around that. And then we also have, one thing we wanted to bring into the conversation was HIV criminalization. So knowing the laws around that and thinking about ways you might protect yourself from potentially being charged with something. And in Louisiana we have an intentional exposure statute which says that basically if you don't disclose your status, that could be considered intentional exposure, and there's nothing in the law that says that you actually need to prove intent. It's not like malicious intent. And it's also, spitting and things like that were literally in the law before. It has been updated a little bit, which is, but there's a clause in there that says exposing someone by any means, and that is still kind of used to go after people if there's blood on a scene or there's spitting involved, especially with law enforcement or first responders. So being aware of that, and I guess do you want to talk a little bit about like steps you can take to protect yourself?
Disclosing is that is one thing. One thing I've started doing and really going to be serious about is getting something signed, stating that they know, and having it notarized going in front of somebody. Because I honestly had a situation with a student was trying to say that I had intent behind them being exposed to my HIV, and there was no exposure, there was no anything, but they were still trying to fall under that. So knowing my law, my abilities, and knowing what I have to do in those cases, that's harm reduction for me. That keeps me from the harm of going to prison or being on the sex offender list. That takes a lot of harm away from it. It's just so important just to know how you can protect yourself. The other thing that helps in that, with the criminalization, is voting. We have to have the right people in place to change the laws, to change the policies. Unfortunately, right now in Louisiana, I'm kind of interested to see how it's going to be going in the next 4 years. Yes, Anita.
Some of the things that we know, well, we all know the Sarah Project, right?
Mm-hmm.
The Sarah Project has this form that you can have somebody. Is that the form that you use? You said
I haven't used it yet, but I'm getting to that because I'm just in different situations in my own personal life where, I mean, I was telling a person for 4 years, sending him interviews of mine. I had told him I was undetectable, and he's still like, "Oh wait, you have HIV?"
Yeah.
And I was like, "Wait a minute."
Yeah. So, and you know, I know a little bit about this topic of how to not get criminalized. One thing we tell people where I live is take your partner to your doctor's appointment. Take your partner to your case manager appointment. Let them document
Yeah.
that person does know because they knew like where they were, something like that.
Yeah.
And also, some people do it on social media.
Right.
They'll put their status on social media.
It's
Mhm.
on
So
every
it's-
one of my
So
statuses.
everybody knows, I don't know how, and there's levels of disclosure, there's a continuum.
Mm-hmm.
So some people may disclose at one place, but maybe they won't disclose on social media,
Right.
you know, but
Yeah, it's like all my dating apps that I used to
You
have.
do,
They all have undetectable HIV positive.
okay.
You know what I mean? Because I feel like
That's important, that's
the
good.
one thing that you're gonna do is browse my profile, right?
Okay.
So
yeah.
you're going to scroll up and down, and I don't have nothing else on it other than like my stats, like, you know, height, weight, you know, the age and that, and then it says it in capital letters.
Okay.
And so I'm like, okay, look, there's no confusion. It's on every one of them,
Yeah.
you know. And so, but it's a double-edged sword because now you are exposing yourself to everyone. So
Right.
now, you know, but to me, it's giving them the right to choose
Yes.
if they want to. So if you come on my profile and now we message and yada yada, I've already disclosed in a way that can protect myself.
Yes.
Right.
And I think also the choice not to disclose can also be a form of harm reduction
Right.
because you may know, that person is then going to come at you either verbally or even physically, in a violent way. And so, that's definitely a way to keep yourself safe.
And myself continuing to talk to this man and educating this man is a harm reduction. Because at any time, he still could say, well, I never knew. So it's a form of harm reduction for me to continue educating him in a way that, he's gonna maybe hopefully go and educate his doctor that told him that even though he's negative, he could show positive in 10 years. So I'm hoping by educating him that's harm reduction for myself and to others in the future.
So the laws in Louisiana, I heard you say intentional, whether intentional or unintentional, does HIV have to be transmitted?
No,
No.
just and that's the other thing too, it's hard to,
Intent.
Intent.
How do you
Right.
measure?
Thank you.
it's also hard to prove that you did disclose, so often it's just, you're gonna believe the person that's pressing the charges,
And then depending on, I would probably have a good chance because look at me. I would have a better chance in a lot of
Than I
areas in
would.
court than you
Because-
would, or even himself, because he is a black man.
Right, okay.
So because I still, even though they would, I just would rather not. That's why from that moment I can honestly say with his confusion, I don't need no confusion anymore. Like I am very adamant that you know what you're doing, you know where you're at, and like this is, and I cannot give it to you. I cannot acquire. You cannot acquire it from me.
Yeah.
But I want you to still know. So.
Yes. So going back to the, I guess, politically active or politically aware or just going to the polls, what do you tell people who say, those people don't care about my vote? They don't care, they've never cared about our votes. Why should I show up so someone else can take my rights away? It's just a matter of choosing what side. I'm giving the devil's advocate question. I kind of
Yeah.
understand that challenge, but what would you say, either one of you, both of you, to people, to communities that just don't feel like the political system, the advocacy is just not speaking for them?
That's exactly why I do think it is harm reduction, because you may not like who you're voting for on either side. You know that you're still gonna, especially in a state like Louisiana, most of the options, they're still not gonna be advocating for what you want and writing legislation that is actually going to help you. But there is usually an option that is worse. And so, like in this past election we just had last month, we have a primary, and the top two will go on to the election that is coming up on November 18th. And the statewide voter turnout was 32%. And I think it is because people, me, naive, young white woman coming into a kitchen that I worked in New Orleans a couple years ago. I went in, mostly black kitchen staff who's from here, and I was like, "Are y'all going to vote today?" And they were like, "No, why would I?" And I was like, "Oh, and I understand that side of it, but unfortunately now we have a very, very scary conservative governor coming in."
Correct.
Yeah.
And I'll say this as well, when it comes to voting, and I just look at this across the board, when it comes to voting, it's always good to package voting as more than just you going into the ballot and pressing buttons. You really have to package voting in a way that appeals to people. So, there has to be an education piece, so there's work that has to be done before the actual election. So that's the education, the advocacy, the grassroots knocking doors, things of that nature. And then there's the voting, but then after that, then what? What are we talking to them about after that to make them understand that even though, politicians, it's easy for them to come around and do what they do. And then when voting either goes one way or doesn't go one way, then they're off to the next feat. For us who are in the community, and we are advocates or activists, because I'm kind of on the activist side, there's work to do afterwards.
Correct.
And so the work that has to be done afterwards, I think, is where a lot of times the ball is dropped. Where we're now explaining to these people, okay, yes, your vote still, it didn't go our way, but your vote still does count. And so I think that's kind of where we lose, especially in Louisiana, company with, just black folk in Louisiana just have a disdain for government, for police, for trying to vote because of the way things have gone for so many years. So I think it's tiered, and you really have to package it all. Because it's not just inclusive of just going and pressing a button. And when we make it about just pressing a button, they're not going to participate. It has to be something that is an appeal to them, and something that appeals on whatever level they're on. So if you're talking to us about social policy, it's going to appeal to us. You go talk to the everyday voter about social policy, that doesn't appeal to them.
No.
Where does it make sense to me as a voter? How does it make sense to me?
Correct. And that's the only way to get someone to vote. Like, my own daughter, when we first got down here, that's when she came of age, was down here, and she was, well, at first, why would I? It doesn't matter. I said, but think about this, your sibling may lose their rights in another state, and that could happen here if you don't vote the way that we need to get the right people in there to keep it where they can be legally married. And that affects it. And Sienna's like, well, I guess you're right. So that's what it is. And we stopped someone from getting in, because we had a turnout vote here not too long ago. We need to do that again to keep that man out. So like I use those things to certain people, you know, to try to get them into circumstances that show that maybe, you know, that the voting did matter.
Yeah.
It really
Yeah.
did matter that year.
And another thing, just kind of veggie bagging. Veggie bagging on what they're real, talking about packaging and packaging. So what we've learned to do is what we call base building. As we go out and do voter registration, we do base building. So now we got this base. So we don't just leave them there. Now we're calling these people and we want to move them up this ladder. Maybe we can get them to come to a meeting. Maybe we can get them to help us go out and get those out. Maybe we can get them to let's find out what they're interested in so we can go and support what they're interested in. So we create this base, this broader base that so that we're not just showing up when it's time for you to vote, but we're showing up.
Throughout the
You're
year.
always seeing us in the community because we don't just knock on the door to get a vote and then just leave.
Yeah.
We ask you, do you mind being on our list?
Right.
So we can tell you about other things we're working on. So we get them to work on other things that we're working on. You know, and so that's one of the techniques that we're using is called base building. And or some people you might hear we call it the leadership ladder. And then we move people up the leadership ladder. We want to get them reach up to bring. If you bring somebody with you, you're another level.
Right.
You know, of a leadership, right?
And I like that because how many times do we get politicians to come in and tell us what their platform is? And they're trying to win us over to that platform when I may not even be interested in it.
Right.
Correct.
Sir, I love the side you're on. I love what, you know, in general, the platform that the party, the organization, agency, your group, whoever. I love the platform, but there are certain things in here I may not agree with because we're not monolithic, right?
Yeah.
And so there's certain things I don't want to hear about. So what about politicians, like you're saying, advocates, coming to us, asking us, what do we want?
Right.
And what type of issues do we want to talk about? And that's the credit to base building.
Yeah.
Because now we're taking, and I guess that's why the Democratic Party calls it a big tent party, because it's a party of a wide range of different beliefs and value systems.
Yes.
So I think we get lost when we don't listen.
Yeah.
Right.
Yeah.
And I think that plays a big part in when you actually get into the polling station and you don't know nothing but the presidential nominee on the ballot, and then you are just pressing what you think, and so that affects, and that's goes into why a lot of people say my vote don't matter, because it really didn't. I just went in there and randomly chose people, so I contributed to just not voting. It's the same thing. So and that goes with education, because we have to educate everyone on what's on the actual ballot, because a lot of us don't see the ballot until you get there.
What do they call the ballot?
The amendment question.
The ballot initiatives.
No one knows what those actually are, and then they're worded so crazy that you're sitting there like, okay, I'm not an idiot, but I still don't understand what this is.
But that's why it's
and then
important
we're
for us
still
to
pressing.
educate.
Yeah.
And ahead of time, instead of just saying,
That's
vote for
right.
this person, vote for that person, let's talk about these ballot initiatives before election day.
But I like that you put it in the frame of harm reduction. Because if you don't put people in office who are going to support the things, your needs, and so you're doing harm to yourself when you don't.
Correct.
Look at the Holl situation right now. The Holl situation right now.
Right? I know.
Like, I made that call to Garrett Graves. Is he gonna do what we want him to do?
Yeah.
And so.
Probably not, because they don't vote for, one side, either side, whoever's in majority never really takes the minority into effect, and so no one is governing all people. Period.
Yeah.
You're governing your own political party, and that's it. Because if you was really governing for the people. You would be sitting here compromising, okay, I hear what our side says, now let's hear where their red lines are, and let's make everybody uncomfortable and unhappy, and that's serving the will of the people.
We wanna be careful not to equivocate though. Let's be careful not to equivocate both sides. Because I think we do that sometimes in the interest of being bipartisan. Let's not equivocate. Democrats will, for the most part, try to look out for the majority of the people. Try.
Yeah.
Doesn't
So
mean they always
what I
succeed.
Yes.
What I wanna throw in here is that just because we give somebody registered to vote, that we're not finished. Then we have to help them plan how you're gonna get to the polls. Even if we talk to people who are already registered, what's your plan, how you gonna get to the polls?
Correct.
Then we have to like give people resources, cause you can get like Ubers, you can get like Ubers and stuff on the voting day, where if you don't have a car, there are ways to get you there.
Yeah.
And then sometimes at the voting place, you have to actually show up with chairs, so people don't leave.
If you're allowed to.
if
And
it's like
so
a
now
lady-
you're participating in a harm reduction
Yes,
program. You are
correct.
now a
Exactly.
harm reduction program.
Yeah,
which
and
is
we sometimes we have like a barbecue grill out at the,
Yeah.
if it's a big election, we'll put out a barbecue grill, we'll have 2 extra chairs and give the older people the chairs so they don't leave, you know, and the smell of food, it takes a whole lot. It takes a whole lot to get them to get in there and push that button,
Correct.
you know?
I like what Sonya said, after what happens too, and I think,
Yes.
you know, like this last year, or when we lost Roe, you know, then we're trying to figure out, okay, what now, because we can't just do nothing. So there are ways that people in the community can work with organizations
Yeah.
and legislators to create bills to reduce harm. So like there was one that was trying to make it at least clearer around guidelines for doctors so that we were reducing the number of birthing people who are potentially going to die
Correct.
because of this. You know, so it's not ideal. That's not maybe how I would go about creating a law like that, but it is going to reduce harm. So, you know, just less reading.
Okay.
So to move on, some of the harm reduction obviously is our syringe service programs, where we do hand out the sterile needles, the other injection equipment, the works is what they call them. We have safe disposal containers for the needles and any other syringes.
Yes.
We have, we do the HIV Hep C testing, linkage to care. A lot of places are doing their treatment. We have our medical director, we're getting ready to do on-spot treatment, rapid start Hep C treatment. The education about overdose prevention is so important. Again, our stories, using the peers as the people that are working that syringe service. The other part of it is, again, when somebody said exchange, part of harm reduction is not being in a one-on-one exchange. Part of harm reduction is supplying what is needed for that person or that group of people. Some of harm reduction is having gatekeepers, people that you can trust, that maybe they don't trust us being there, or they don't trust coming to us, but they trust going to this one person in their community as a gatekeeper. So we set up gatekeepers, things like that. A lot of, just a lot of one-on-one with them. As many avenues as we can for resources. The one thing I know at our syringe service, we do not push detox and rehabilitation. We talk about it, but it's not something that we push because you can always push somebody the other way by talking about it too much. They may be right here at the door, and you keep saying something about, well, you're gonna be in detox, they might like, okay, well, I don't know.
Yeah.
So that's part of harm reduction, like, I've seen it happen. So that's part of harm reduction. Go ahead, Jane, say something.
Oh,
Well, so just kind of, I work as a mental health therapist, and I do use harm reduction with my clients. And I've worked in alcohol and drug treatment before as well. And what I know about it is that by and large, the treatment community, at least from my experience, but that's why I'm posing the question, is not largely accepting of harm reduction. Now, when you look at programs such as the one you were just talking about, syringe exchange, those areas of drug treatment and they are more accepted. So clearly, like you ladies who obviously have done that work, definitely see the value of harm reduction. But what is your thoughts about the state of where alcohol and drug treatment is? We're still, it's one of the main areas of behavioral or mental health interventions that has not really moved in 50 years or more. Where we're still, and I'm not saying, I'm not speaking against Big Book or 12 Steps, because I do think that it's effective for some people. However, if we look at the data, it's not effective for the majority. Or actually quite a small number in comparison to the people who need the services. And it's kind of disappointing that the only thing that we have in our arsenal is these interventions that we've been using for 50 plus years, and that only harm reduction it's still not even largely accepted, at least not from what my understanding is. But I was wondering from you ladies, do you have anything to add about that?
That's why I'm loud. That's why I'm loud about it. I'll be 100% honest, because people don't understand that it's harm reduction, that it works. We have a lot of problems with some of the detox locations and rehabilitations. They will not allow us to put our information in there because they are abstinence based only. Not understanding how many lives we're losing because people don't understand that once you do detox it to a certain level and you go out and use again, you think you're going to use at the same level you were at. Just like myself, I haven't touched crack cocaine in almost 11 years, and I'm go out there thinking I can do that big old rock again. I'm going to be on the ground, gasping for air, and my heart's going to be racing out of my chest. You know, so it's all you can do is keep talking. Our stories are going to say, I did not use detox. I had to do it on my own. I used marijuana. You go into any kind of detox rehabilitation center and you can't talk about it. So my harm reduction, the way I stopped, was just by myself. So I tell people, just because I could do it that way doesn't mean you can, but just because you used the facility in the 12 steps doesn't mean that everybody has to do it your way either. We have to look at everybody as an individual when it comes to harm reduction and the usage of detox centers, and realizing that everybody is individual. I mean, that's my perspective of it, is that like we have to individualize everything. It's not gonna win. We're not gonna win the battle by making everybody go in. We have to realize that, again, just because you're addicted to one drug doesn't mean that your harm reduction might not be using something in a smaller dose or using in a smaller dose. And people are so on abstinence instead of harm reduction.
Yeah.
And I think medication-assisted therapy is another option that in the state, correct me if I'm wrong, but there are not a lot of facilities that are offering that.
No.
And that, I believe, is more effective than just like a 12-step detox program.
They're using
And
something in
detox.
Philadelphia called Vivitrol.
Okay.
There is Vivitrol down here. Vivitrol.
I'm not sure.
It's for people who like alcohol, but it takes away
Yes.
your craving.
I don't know if they
For
use it down here,
And it
but I
makes you
have heard
sick
it.
when you
Yes.
consume it, you mean?
It doesn't work. It doesn't. I think you don't. I don't know,
No,
but
you
I think they
don't
said you
feel
don't feel it. You don't have the craving for it, and if you get it, you don't get high.
And then I
But you
know
have to
some.
get a shot. They give you a shot in your butt like every 30 days. They do it at the clinic I go to.
Yeah, and some, I know some that actually do make the persons, it will make them actually sick.
Or make
Yeah, I
you
know
sick.
about
Yeah.
being sick. I
Thank
don't know about not
goodness.
having the craving.
He's
They
done
said
that for me. I think he gave me that naturally, because if I have more than one drink, I am like, I'm sicker than anything that I stay. So I
Okay.
think that, we did, now everybody knew about Narcan, right? And how
Yeah,
to
but the slide before that, you talked about having somebody test their own
Oh, okay.
substance.
Oh, yeah,
Yeah.
This
What
is
is
right.
this? What is these strips?
alright, so we
Fentanyl
have,
and
yep, we have,
Xylazine.
xylazine is a horse tranquilizer that they're mixing into the supply now.
Right.
And it is
okay.
causing MRSA,
But
like,
that's the one that gives you the source from the inside out.
yes, yes.
Right.
So we do have, we're working on, but we do have fentanyl, and there are xylazine testing strips that you can take a small amount of the drug and you can test it, test your supply.
I really want to know how does that work? You cook the drugs up first?
You
Well,
just
there's
mix a
two
little bit
different-
of water.
yeah.
Oh, you
like-
mix
Because there's two different tests, because the
Right.
ones that
Yeah.
we're using now, you have to actually take a little bit of your product and mix it and then test it.
Okay,
Now,
wow.
we were just introduced to another kind of test that actually just takes the swab of the substance and then dissolves into it and then gives you a. So I think that's better because when you are eliminating them sacrificing their
Right.
drug of choice,
Right.
you know, just to test it, you will get a lot more people if you can just quickly do it. And so, yeah, so I'm looking into those because they both have
So you
the
swab it
xylazine
and
test
swab the
and the
person.
fentanyl test.
Right.
is correct.
Swab
No,
it.
you're swabbing the drug to
So,
see if fentanyl or xylazine is present in
Right.
the.
right, it doesn't give you an amount, like,
Right.
so in my son's case, he had 41 milliliters of fentanyl in his system when he passed. He would have known the fentanyl was there, but he would not have realized that there was that much in there, but we never know, it might have stopped him from even doing what he thought was just hydrocodones crushed up.
But
So-
if even if you have 2 or 3 strands of little nuggets of fentanyl in something, you
It'll
can
happen.
produce an overdose.
Mhm.
So fentanyl being present at all, you know,
Yeah.
you
Okay.
you definitely, especially when you're talking about harm reduction or reducing the harm of the person, what you're doing is letting them know fentanyl is present. So if you are going to continue it, don't use alone.
Correct.
You know what I mean?
Okay.
Don't use alone and have Narcan, naloxone present, so that, you know, so if you're gonna do it, now you can identify a safer way of doing
Someone
it.
here.
So they're gonna do it.
Yeah,
Right, because if my son would have had somebody with him,
Wow.
you know, so, and that's, I've gone through about 2,000 of my business cards because I give my
This is
number out
crazy.
as a never use alone number, because I don't let anyone alone.
This is crazy.
Some of the facts about SSP participants is that they are 3 times more likely to report a reduction in injection frequency. And we see that over and over again in the almost 4 years now that I've been at CART. They're also 5 times more likely to enter a drug treatment program because they've heard about it. You know, we talked to them. They're 3 times more likely to actually stop. On many things, if I would have had a harm reduction, I wouldn't have fake teeth. If I would have had a harm reduction, I may have stopped sooner. You know, it really works. We've seen it. We've got proof in our participants, our guests. Like, we've seen it happen. Anything you wanna add with yours?
No, I mean, I think just one thing that I wanted to just share, I guess, overall about the harm reduction framework is, you know, I think the goal shouldn't be treatment or getting someone to stop. Obviously, you know, that would be wonderful, but it just, I think, looking at it as any positive change. So I think,
Okay.
you know, that kind of.
yeah, whether it's a reduction of how many times you come a week,
Right.
how many syringes you get at a time,
Right.
you know, and so when you see those levels of progression, you know that, you know.
Okay. Yeah.
All right, so I know we're pretty much at time, and we did have a few more things to go through, but it's been a great discussion, so
Yeah.
that's fine. We just gotta remember that we are people, and everything that we talk about should be person first. It always should be person first.
Your names and contact info?
Yeah, we just had a,
Get to those.
we're trying to get,
So we're
we're trying to get, overdose prevention centers in Philadelphia. Right, and we just went to city council and all did like testimonies and they voted the same, that's it now.
Yeah.
You know, so now we're like strategizing how to get them, and how can we get a couple of champions to change their mind and be voted.
I did want to add one final thing, if that's okay,
Yeah.
just because this, you know, is for, we're thinking about people aging and living with HIV.
Yes.
So also, if you are choosing to use drugs, just thinking about how that interacts with you as you're getting older, other medications or comorbidities you might have, and also especially with your HIV medication, because there are some drug interactions that can cause you serious harm.
Yeah.
So just being aware, especially with things like
especially when you take Genvoya, if you have that booster in your HIV medication.
Yeah.
And I'm not gonna lie, that was one of the first questions I asked my pharmacist,
Okay.
because I wanted to know if I was anywhere, what would happen.
Yeah.
And so I don't leave anything around it with any get-togethers.
People are going into recovery programs now, and they get the urine analysis and stuff before they go in. And they say, they're telling, I know you gotta go to a 12-step program, so they come and tell the stories. And they say, well, I was doing something crap, but when I got there, I had this in my urine, that in my urine, it was all this fentanyl, all these other things. It was in the urine, everything but crap was in the urine.
Yeah.
Right, so I don't know what that's about.
Because
sure you do. You know exactly what it's
Tell
about.
me, what is it
You
about?
go to buy crack and it wasn't crack.
Right,
for one,
okay.
for one, that, and for two, because some people in our lifestyle feel that just because I smoke crack, I'm better than the person that's shooting up. And I hate to tell you, but we're all the same. Like, we are all the same, but people have that, again, it's external
Yes.
stigma
Yes,
that creates that makes us think that we're better than the next person,
Yeah.
even though we're all doing the same thing. Cause I'm sorry, but that Karen that's out there doing all that shopping every day, she's just as bad as I was when I was sitting there with that crack pipe. On that.
Alright, you have to progress better. But-
Introduce yourselves again.
Again, I'm Jenny Holl, I'm the epidemic program manager at the Vision. My contact information is there, you can learn more about our programs at www.av-no.org. Come through if you need some harm reduction supplies in New Orleans.
Sonya Milliman, I am the harm reduction and prevention coordinator at our Be Safe syringe program at Capillary Entry Program in Baton Rouge, Louisiana. You can reach me at my email on there, and we also have our website at carpbr.com. And again, 716-238-3555 is a never use alone number. Use it, please.
Thank you.
Thank you.
Thank you so much. Very good